All right, welcome back. Well, if you're feeling a bit under the weather, could it be because of the weather? We're joined now by emergency medicine Dr. Miriam Fisher of MedStar Health to either debunk this or maybe instruct us on how to avoid some of these swings that come with the temperature swings. Doctor, thank you so much for being with us here this afternoon.
Absolutely. I'm thrilled to be here and welcome to spring. And you are right, it's not just you. With those changes in the weather, with the change in barometric pressure, a lot of stuff in the air and it impacts your body. Absolutely.
Yeah, because we hear those sayings, I can recall my grandma even saying when it gets too cold, you're going to catch cold, cover your head, and now it's the opposite side of it, maybe the warmer weather. Can these weather swings make you sick?
Yes, they can. You don't always need a hat, but joint stiffness, migraine, sinus problems, shortness of breath, even inner ear problems can happen with these changes in the pressure. I worked in the ER this past weekend and I saw a lot of asthma. So these changes in what's in the air is impacting people's lungs. So this isn't you, this is real. You can prepare for it and we can all enjoy spring. We just need to be a little bit ready and thoughtful about how we do it.
More thoughtful. Yeah, talk to us. You say you were already seeing it. You're already seeing some of the impacts to our body from this. You mentioned asthma. Walk us through some of the other symptoms people's bodies may be experiencing right now.
For those itchy eyes and that sneezing and runny nose, that's not just you, it's the allergens out there. There's a lot of really excellent over-the-counter medicines. That's what I take. That's what my patients start with. The nasal sprays right up that nose to where it's bothering you, the pills, but you can't wait until it's too late. You can't wait till you've been outside for an hour and you're all itchy. If you know this is your problem, pick them up now. Have them ready, start taking them in the morning. The same for our asthmatics. Now's the time to fill your rescue inhaler if you use it. Watch the pollen count, even if you have to wear a mask so you can be outside longer. We can still enjoy spring, we just need to be prepared and think about it.
Just pay attention to your patterns. Know if you experienced this maybe last year, stay ahead of it, stay on top of it. A great advice, doctor. You mentioned the asthmatic. That might be a group that's more vulnerable right now. Any other groups who are particularly vulnerable, and how can they protect themselves right now?
We're getting to that season. Sun, bugs, those are things that we think about early and often for kids. Get in the habit now. If you go outside, you put on sunscreen and you put on a hat. You wear your bug spray. The other great idea as we think about spring cleaning is change those filters in your house. Get some clean, fresh air. It will prevent all of us from getting sick. Simple things that our mothers taught us: wash your hands when you come in. There's a lot of people sick out there. You'll wash that off. You'll also wash off some of those allergens and not spread them around your house. Make sure you're drinking well and staying hydrated with the heat and the changes in the temperature. Sleep well, eat well. All those things we all know how to do and come easy to us will keep us all healthy.
I love that. Just wash your hands, physically get rid of some of those allergens. Those are great strategies that we can use to stay healthy. Doctor, when is the point where it's not just allergies anymore and it is something more serious and we should go see a doctor?
Really happy you asked that. Don't ignore things that don't feel right. Allergens exist, they're real. Allergens aren't in one eye only. Allergens don't make you not be able to see. Allergens don't make you short of breath. They don't give you a fever. Your doctor is happy to take care of. We are always happy to take care of you in the ER if you need us and if it just doesn't feel right.
That is such good advice. If anything, it's just out of the norm. Doctor, additionally, we talk about some of the physical signs. Is there any mental impact here? I know we're just coming out of the season where it's dark winter, and I know we talk about seasonal depression. We're getting a little more light at the end of every day, which is good. Any mental symptoms you see, or are we turning the corner there finally?
So we're turning the corner from the dark and the depression and the sadness to the fun in the spring, but we do see some more mania. People are out there, they're excited, there's more drinking, there's more socializing, so there's a risk for overindulging. If you start feeling out of control, get ahead of it. The same way that you would get ahead of your asthma and fill your inhaler now before you get sick, if you start feeling like your mental health is in trouble, come early and we will take care of you and you won't get out of control.
Really, really great advice, and it sounds like truly prevention and paying attention is key. Dr. Miriam Fisher with MedStar Health, thank you so much for joining us, and hopefully that ER stays nice and calm for you.
And we will always take care of you if you come in.
Thank you. Thank you so much, Doctor. We appreciate it. And stay with us. We will be right back after this quick break.